I know what I'm talking about today. Hi, everyone. It's Dr. Jacqueline Cortez Salmons here at Transformation Health and Wellness in Anaheim Hills, California. I'm glad you could join us for Wellness Wednesdays today. Today, we're going to be talking a little bit about the importance of physical exams. I know with all the whole COVID quarantine, everything being shut down, including our doctor's offices, we've really embraced the idea of telehealth medicine. And I think that there is absolutely a role for that in modern medicine, kind of how we do things. I'm always happy to consult with my patients via telehealth visit or even phone conversation. We can definitely go through labs in that manner. We can talk about ongoing issues, even if it's kind of a psychological type of concern, then anxieties, that kind of thing, which are definitely on the rise right now. We can certainly address those things in a teleconference type of setting. However, I don't ever want to negate the benefits of a physical exam. It's something that's just so important for patients to undergo this kind of very sacred encounter with their physicians and make sure that you're getting those physical exams on a regular basis. It's not even an annual exam, right? Obviously, there's that role for our annual exam, have somebody listen to your heart and lungs and, look in your eyes and your ears and do all of that stuff. Absolutely, that's critical on a yearly basis, but also just the physical exam in and of itself is so, so important. And again, it helps with that very sacred encounter, that trust that gets developed between a patient and a physician. And so something that's very, very critical for that exam. For example, just a couple weeks ago, I guess it's been about 2 weeks, I had a patient call in, patient's mom actually, call in and say, my daughter dropped a large table on her foot. I think she needs an x-ray. Can we bring her in? So, of course, yes, please come in. We've been open through this whole crisis, which has been really, really beneficial. Of course, she was too scared to go to urgent care, too scared to go to the emergency room. She didn't want to be exposed to all the viruses and bugs that are there, much less COVID. Remember, there's all these other viruses and situations going on out there in the community. So she didn't want to expose herself. Can we come in? Yeah, of course. If I had left it at that, as just a kind of a telephone conference or even a Zoom meeting such as this, where we're just kind of looking at each other from the torso up, easily I could have just said, yeah, here's your prescription for a foot x-ray. I'll get the report and then decide what we need to do from there, right? It would have been very simple. But actually, when she came in, I was so thankful that she did, because now her foot was all kind of wrapped up. And as I started unwrapping her foot, actually, you could see blood staining through the bandages. And what she had actually done is avulsed her entire toenail from behind the cuticles, the cuticle actually, and the entire thing ripped off. And there was a huge laceration on the top of the great toe that needed to be sewn up. She had actually crushed the most distal portion of her great toe. So this bone is fractured into 3 pieces. She fortunately does not need surgery. I was able to call our local friendly podiatrist who's in our building, who's very gracious in coming over and visiting her and checking things out, making sure I wasn't missing anything. But something that absolutely had to be done in a physical exam setting. It was not something that could be done via telehealth. Even for an upper respiratory infection, which we used to kind of consider like, it's a cough, it's a cold, it's no big deal. But for me to be able to look in somebody's sinus and nasal passages, to be able to look in their ears, to be able to feel for lymph nodes, I can't see that on a telehealth visit. Right? I can't look in the back of your throat and see, is it actually tonsils that are swollen? Is there pus? Is it just something that looks like postnasal drip and maybe more related to allergies than an infectious source? Poking on somebody's belly, listening to lungs. These things are so critical from a diagnostic standpoint that over and above help us. Because again, even somebody who has a cough or cold, I can sometimes hear if it's something in kind of the upper airway, like congestion here, versus if there's decreased breath sounds, wheezing consistent with asthma, decreased breath sounds consistent with pneumonia. All of these things are going to tell me something far and away, like over and above what an x-ray would tell me. An x-ray just tells me really like, is there lung collapse? Is there a broken rib? Is there a pneumonia? So very kind of severe things, then the x-ray or that technology comes into play. But from that clinical exam standpoint, it is so critical. When I was working in a greater capacity as far as seeing more and more patients in the hospital wards and so forth, I oftentimes had nurses and even patients comment to me, they're like, you're the only doctor who's actually come in and examined me. Or you're the only doctor who does rounds who actually goes into the patient room. And I was just kind of shocked by this, that how are you not examining? How do you evaluate a post-operative patient, for example, who's either had a C-section or a hysterectomy, without actually looking at the incision, without actually poking around the incision and making sure that there's no blanching, that there's no infection, that there's no, gathering of fluid within that incision. And again, the only way you can do that is through a physical exam. So I would insist that if you're a patient out there, that you insist on a physical exam, at least on a relatively regular basis. So again, if you're coming in for a blood pressure check, and if you're just going to continue on your lisinopril, can I just get a refill? You probably don't need like a gynecologic exam to refill your lisinopril, right? Within reason. And we want to have that exam make sense. But by the same token, to have somebody actually listen to you, listen to your heart, figure some things out. Again, my 88-year-old patient who I diagnosed in the midst of a heart attack earlier this year was because of physical exam. His presenting complaint was not chest pain, right? It wasn't like, hey, let's just get this EKG and see what's going on with you. His complaint was constipation. He felt upset stomach. He didn't feel right. Right? This is a big complaint from patients, and typically a very ominous one when patients say, I just don't feel right. Something's wrong. And I absolutely perk my ears up when that happens, because some of the sickest patients I've ever taken care of really didn't have a whole lot going on from a lab standpoint or a very obvious perspective. It wasn't something you could just point your finger at, and they get sick very quickly, and all of a sudden it became very clear what they were sick with. So in this instance, he complained of like just pain. I'm going to back up a little bit. Just pain kind of in this upper belly. So just right under his rib cage, just kind of didn't feel right. And again, there was something that just kind of like that spidey sense, something in that intuition, and just years and years of experience of examining patients, listening to patients, knowing kind of how this story ends. There's something that perked up in me, and I'm like, that can also be a heart issue. When we have epigastric pain, it can also be an issue with heart. Let me just listen. Let's just figure out. And sure enough, I heard a horrible murmur. Like, that's not so normal. I hadn't really examined him from an EKG standpoint in the past, relatively new patient. So I'm like, let's just get an EKG. Sure enough, I see EKG changes. We sent him to the hospital. He ended up with a stent the next day because he had a 90% blockage of one of the largest vessels in his heart. And he wouldn't have gotten that if it was just a matter of, well, I don't know, you have constipation. Let's just send you home with some Miralax. Again, if that were a telehealth conversation, he would have died in the middle of the night. He actually had another cardiac event at about 1:00 in the morning. So if he hadn't gone directly to the hospital like I instructed him to, gotten admitted, and actually they were not impressed with his symptoms when he first showed up. They weren't impressed with his EKG changes. It wasn't until they got some lab studies back that they're like, oh, like I better pay attention. And thankfully they did, because he got admitted at 1:00. He had horrible chest pain. They had to give him nitroglycerin paste. They had to do oxygen and kind of rescue measures. Then the next day he got his stent placed. And again, if I had just seen him via this type of encounter, it would have been like, I don't know, take your stool softener, take some Colace, drink lots of water, eat some veggies, and go to bed. And he would have passed away. So there's definitely some value to, significant value really, to physical examination. If you're following me on Instagram and Facebook, I'm also posting about an article. It's a very brief, easy to read article. These are the articles I love. When you get all into the semantics of this pathway and that pathway, I get a little nerded out and excited about it, but I like to present to you some of the kind of not so editorial, but some of the easier to read and digest articles, because then they can be more relevant to you. But this one in particular is about the benefits of physical exams, even to a physician. And they talk very much about the healing power of touch. And I think this is something that is very relevant right now in the age of like social isolation and physical isolation that we've been experiencing through this COVID crisis. Everybody's very hands off. We're all with our masks. We have no facial expression. Remember, about 20% of our hearing actually comes from lip reading, even if you have intact hearing. So we're kind of losing a lot of the message. We lose a lot of the body language because we're sort of like kind of covered up. And because we're not touching, because we're not near one another, we're really suffering from an overall health standpoint. I've seen it in my practice that anxiety is up, depression is up, alcohol use is up. I won't say alcoholism, but definitely alcohol use is up. There's a lot of ill effects that are coming from this position of us kind of not having encounters with one another. And so when my patients come in, I make it a point that at the very least, it's like a hand on the shoulder, again, then hand sanitizer, that's fine. We can be responsible in our encounters. But by the same token, there's actual healing in the power of touch in and of itself. Now, I'm an osteopath. I'm trained to diagnose and treat with my hands. These are like certified tools, right? Weapons, if you will. Not ninja status by any means, although like #goals. But aside from that, I do use my hands to actually feel and to diagnose, and whether that's the cervical spine, whether it's thoracic spine, whether it's chest wall, like ribs, shoulders. I've had a patient that I'm following right now with a bicep tendon that just doesn't want to behave itself. Knees, ankles, you name it. I'm diagnosing with my hands all the time. And then I also will treat osteopathically with my hands. My husband, on the other hand, not an osteopath, not a medical professional. But the other day, he just kind of placed his hands on my neck and just like kind of rubbed out my shoulders. He is by no means a massage therapist. Ladies who have husbands out there, you know that they're kind of not massage therapists unless they've been trained. But even in that, I felt this sense of calm. I really felt a relaxation, like doctors heal thyself, right? We never seek care. I never go to get a massage. I don't take care of those things. I know I should. Notes to self, I will. But I don't on a regular basis. And so even just having his hands on me, just kind of working out a little bit of those muscles, as brief as it was, as kind of unskilled as it was, I still felt the power of just having that human to human encounter. Just having that touch was so significant. And again, I think that in the age of technology and us using MRIs and ultrasounds and lab studies and all these wonderful tools that we have, and they're great tools. I will not negate that, but it does not take the place of that physical exam. So something definitely to keep in mind. So I hope that if you are a patient, that you go out there and you make sure that if you're really concerned about something, you feel like your doctor's not quite hearing you, like, would you mind just listening to my lungs? Would you mind just palpating my abdomen and see if there's anything that you feel, right? And then from a physician provider standpoint, nurse practitioner, whatever capacity of a healthcare provider you are, remember to examine your patients. Again, like I oftentimes teach my students, if you don't ask the right questions, you're not going to get the right answers, right? So you have to ask that question with your hands, actually feel those abdomens. You will find that sometimes you can feel a uterus all the way up to the umbilicus or the belly button. You can feel an enlarged liver. You can feel an enlarged spleen. You can feel tumors. You can feel, irregularities. You can listen to the bowel sounds. We have 5 senses for a reason. There's even times I can walk into a room and I can tell you if a patient has cervical cancer without having even had her undressed. It has a very distinct smell to it. There are other types of infection that have a very distinct smell. There's a difference between E. coli, for example, and Pseudomonas. And I can pick it out of a crowd hands down, again, without even looking at an incision. I can tell you if it's infected. So use your senses. This is part of the art of medicine that actually ties in so fundamentally to what science is, right? The art of actually performing a physical exam is part of the science of observation. Science fundamentally comes from making observations and then studying that observation with variables, right? And then drawing conclusions about the observations that you made. That's exactly what a physical exam is. I make an assessment based on what you've told me. Then I make an observation based on what my hands glean, what my eyes see, what my ears hear, and even again, smell, sense of smell. And then based on the information that I've gotten in and what I've observed and what I've examined, and then I make a conclusion, oh gosh, I think you just have constipation, or I think you have a heart attack, or I think XYZ. Then I order the technological studies to prove whether I'm right or wrong, right? So even during the first week of medical school, I was told that if you take a very good history and do a good physical exam, you almost don't need those studies other than to prove yourself right or wrong. And again, I've been wrong, right? I've thought somebody has preeclampsia and they didn't have preeclampsia. They actually had a thyroid storm, but there was something wrong. So without a doubt, we still got down the path towards appropriate diagnosis because of physical exam, first and foremost. So I hope this is helpful. I hope you find it interesting. Definitely, if there's any comments, please leave them below. Please make sure you subscribe, click notifications so you can get notified when we are on air again. And I look forward to hearing from you guys next week. Take care. Have a great rest of your week.